This is Charlotte Figge. This is a more recent photo of her. As you can see, she's doing well. But that wasn't the case when she was younger. Charlotte had her first seizure when she was 3 months old. The seizure lasted about 30 minutes. Her parents, Matt and Paige Figge, rushed to the hospital. When they arrived at the hospital, the doctors performed a workup, but they couldn't seem to find anything, and they were sent home. A week later, Charlotte had another seizure, only this time it was longer. This continued over the next couple months. The seizures lasted around 2 to 4 hours, and they were more frequent. And she had to be hospitalized regularly. The doctors were stumped. They had no idea what was causing this. All the blood tests and scans were normal. Nothing seemed to be out of place. Paige recalls, they said it's probably going to go away. It is unusual in that it's so severe, but it's probably something she'll grow out of. But she didn't grow out of it. The seizures continued, and Charlotte had to be at the hospital for longer periods of time. One of the doctors that was treating Charlotte suspected that she had Dravet syndrome. Dravet syndrome is a dangerous type of epilepsy, also known as severe myoclonic epilepsy of infancy, or SMEI for short. Dravet syndrome can progress to different types of seizures, such as myoclonic and partial seizures, ataxia, and psychomotor delay. Children with Dravet syndrome usually experience delayed development in language and motor skills. They have difficulty sleeping, and they tend to have growth and nutrition issues. And the seizures experienced by people with Dravet syndrome, they usually worsen as the patient ages, and that's exactly what happens. Charlotte's seizures get worse and worse. They come in clusters, lasting 30 minutes, one after another and after another. The medication that Charlotte was taking was also taking a toll on her. She was on about 7 drugs. Most of them were heavy duty. They would work for a while, but the seizures would always come back. When Charlotte was 2.5 years old, she was taken to Children's Hospital, Colorado, where she would be tested for the SCN1A gene mutation. It's a common gene mutation in about 80% of Dravet syndrome cases. A neurologist there that was taking care of Charlotte tested her for the mutation, and 2 months later, the test came back positive. The Figges were quickly running out of options. They considered a drug from France. Doctors suggested an experimental anti-seizure drug that they used on dogs, but they eventually decided to go to Chicago to meet with a Dravet specialist. The specialist put Charlotte on a ketogenic diet. The diet is supposed to force the body to make extra ketones, which are natural chemicals that the body produces that suppress seizures. The diet helped control Charlotte's seizures at first, but it had its side effects. She suffered from bone loss, her immune system plummeted, and to using the diet, the seizures came back. Charlotte's parents were starting to lose hope. Matt found a video online of a Californian boy whose Dravet was being treated successfully with medical cannabis. The strain of cannabis that the boy was using was low in THC and high in CBD. THC is short for delta-9 tetrahydrocannabinol. It's the main psychoactive ingredient in marijuana. It reacts with the cannabinoid receptors, right there. That's THC receptors. It reacts with the cannabinoid receptors that are part of the endocannabinoid system in our bodies. When someone smokes marijuana, the THC overwhelms the endocannabinoid system and can cause a wide range of effects. It can slow someone's reaction time. It can disrupt the ability of that person remembers something that just happened. It can even cause anxiety or affect that person's judgment. THC also affects the part of the brain that makes someone feel good or euphoric. That's what causes the so-called feeling of being, quote unquote, high. The CBD, or cannabidiol, is the other main active ingredient in marijuana. It lacks the psychoactive property that THC has, but it has proved to be of beneficial medicinal use. CBD has many medical properties such as anti-inflammatory, anti-tumoral properties, anti-psychotic properties, and anti-convulsant properties, which suppress seizure activity. By this time, Charlotte had declined cognitively. She lost the ability to walk, talk, and eat. She was having close to 300 grand mal seizures a day, or a week, and her heart stopped a number of times. That's when Paige decided to try medical marijuana. It would be hard to find 2 doctors to sign off a medical marijuana card, but She eventually did. At the time, she was probably the youngest person to apply for medical marijuana. I think she was 5 at the time, I forget. But Paige quickly found a Denver dispensary that sold a type of marijuana called R4. It was said to be low in THC and high in CBD. And she paid about $800 for 2 ounces. That's a lot of money. And she had the oil extracted. They started on a small dose for Charlotte, but the results were significant. Charlotte's seizures stopped for the first hour, then the second hour, and then for the next 7 days. But they were soon running out. Paige soon learned about the Stanley brothers. They were also breeding a strain of marijuana that was low in THC and high in CBD, but they didn't know what to do with it. The brothers started the Realm of Caring Foundation. It's a non-profit organization located in Colorado. It provides cannabis for next to free for children and adults suffering from varying diseases such as epilepsy, cancer, Parkinson's, etc., etc. The strain of cannabis that Charlotte and many others use to this day is nicknamed Charlotte's Web. Today, Charlotte is 9 years old and is thriving. She takes a dose of cannabis oil in her food 2 times a day, and her seizures have reduced to 2 to 3 times a month. I hope with this presentation I showed you guys the good things that this drug can do for many people like Charlotte. Thank you.